Hello my friend, Dr. Amar again, and in this video lesson we'll talk about muscles of the back. Muscles of the back are divided into extrinsic and intrinsic parts. In this video lesson we'll talk about the extrinsic muscles. In the next video we'll talk about the intrinsic muscles of the back. At the end of this video lesson we'll have 35 review questions to test your knowledge. If you have any question you can email me here at amar@goodrational.com or comment your question down below. Now before moving forward, this channel is made for you, my friend, and uploading quality content takes time and effort. So please, if you're awesome, I know you are, please give big thumbs up, subscribe to the channel, and share with your friends. You can hit stay notified to keep up to date with all the great quality content I will be uploading for you. And thank you. Here are the objectives, or what we want to get out from this video lesson. Basically, everything about muscles of the back. Now, muscles of the back are organized into three groups: the superficial, intermediate, and deep group, depending on the depth of muscle layers. Superficial, intermediate, and deep, depending on the depth of muscle layers. First, we have the superficial, then intermediate, then deep. They are also organized into extrinsic or intrinsic, depending on the embryological origin and the type of innervation, because the extrinsic muscles have the same type of innervation. The extrinsic muscles are the superficial group and the intermediate group. And why they are called extrinsic? Because embryologically they have been developed from regions outside the back. They have developed from regions other than the back. While the intrinsic or the deep group, they have been developed embryologically from the back. Now in the deep group, we have a subgroup, which is the suboccipital group of back muscles. This group is involved specifically in movement of the head. Now the superficial group of back muscles are involved in movement of upper limbs. Intermediate group are involved in movement of ribs, and that's why they are considered as having a respiratory function. The deep group is involved in movement of the back, which is the vertebral column, and the suboccipital muscles of the deep group are involved specifically in movement of the head. Let's talk about each group individually, starting with the superficial group of back muscles. Why they are called superficial? Because they lie superficially just behind the skin. They lie superficially just behind or deep to the skin and the superficial fascia. They are called superficial because they lie superficially just behind the skin and the superficial fascia. We have 5 muscles in the superficial group. We have the trapezius, latissimus dorsi, the levator scapulae, rhomboid major, rhomboid minor. Trapezius, latissimus dorsi, levator scapulae, rhomboid major, and rhomboid minor. Trapezius, latissimus dorsi, levator scapulae, rhomboid major, and rhomboid minor. Now the rhomboids and the levator scapulae are located behind the trapezius muscle in the superior part of the back. Rhomboids, levator scapulae are located behind the trapezius in the superior part of the back. This group of back muscles are also called the appendicular group. Why? Because they attach the appendicular skeleton to the axial skeleton. And what is the appendicular skeleton is composed of? The appendicular skeleton is the clavicle, scapula, and humerus. Clavicle, scapula, and humerus. And what is the axial skeleton? Head and vertebral column. They attach the appendicular skeleton to the axial skeleton, and they are involved primarily in movement of this appendicular part of the skeleton. Starting with the trapezius. Now each time we describe the anatomy of a muscle, we should describe 7 things. First, the shape of the muscle. The shape of the muscle. The position, origin and insertion, blood supply, nerve supply, and type of movement or function of the muscle. The function of the muscle. Shape, position, origin, insertion, blood supply, nerve supply, and type of movement. Now trapezius is flat triangular in shape. Flat triangular in shape. Flat triangular. And anytime we say a triangle, we should describe the base, the apex, and the fibers. Upper fibers, lower fibers, and middle fibers. And why it's called the trapezius? Because the trapezius on the right side, along with the trapezius on the left side, they form a trapezoid shape. They form a trapezoid shape. Okay, flat triangular. The base is situated along the vertebral column in the upper part of the back, along the vertebral column, the muscle origin, and the apex is pointing towards the tip of the shoulder in here, the tip of the shoulder. Now let's talk about the fibers. The superior fibers from the skull and the upper portion of the vertebral column, the skull, upper portion of vertebral column, are attached to the lateral portion of the clavicle and the acromion process. And so they elevate the scapula. The lower fibers depresses the scapula. Middle fibers adducts the scapula. Upper fibers elevate. Lower fibers depresses. Middle fibers adducts. They assist in rotating the lateral aspect of the scapula upwards when you raise your arm above your head. So that's the shape and position. Let's talk about the origin and insertion. The origin of the trapezius is the external occipital protuberance, superior nuchal line, nuchal ligament, and spinous processes of 7th cervical to thoracic 12. External occipital protuberance, superior nuchal line, nuchal ligament, spinous processes of cervical 7 to thoracic 12. Now the insertion is lateral third of the clavicle, the acromion process of the scapula and the spine of the scapula. Lateral third of clavicle, acromion process of scapula and the spine of the scapula. Now let's talk about the innervation and blood supply. In case of blood supply, we should describe how the medial part of the muscle is supplied, and how the lateral part of the muscle is supplied, so that when we mention arteries, it makes sense. Now the innervation. The trapezius muscle in here is supplied by the spinal accessory nerve, which descends from the neck deep to the superior surface of the muscle, and proprioceptive fibers from the muscles is transmitted through cervical plexus at level of C3 and C4, through the cervical plexus. Now the blood supply, as we have said, we have medial part, middle part, and lateral part. As you can see here, dorsal branches of posterior intercostal arteries, they supply the medial part, dorsal branches of posterior intercostal arteries. How is the middle part is supplied? By superficial branch of transverse cervical artery, Now let's see how the lateral part of the muscle is supplied. It's supplied by the acromial branches of suprascapular artery. Here is suprascapular artery, and here is the acromial branches coming to the acromion process. Here is another picture, the acromial branches of the suprascapular artery. So we have dorsal branches of posterior intercostal arteries supplying the medial aspect of the muscle. We have the superficial branch of transverse cervical coming downwards. Superficial branch of transverse cervical supply the middle part, and the acromial branch of the suprascapular artery supplying the lateral part. Now latissimus dorsi, shape, position, origin, insertion, blood supply, nerve supply, and type of movement. The shape is also flat and triangular, and it tapers as it ascends to a narrow tendon that's attached to the anterior superior surface of the humerus, This is a 3D picture of the latissimus dorsi showing that it's attached to an anterior superior surface of the humerus. So according to this orientation, what is the type of movement? It extends, adducts, and medially rotates. The humerus. Extends, adducts, and medially rotates the humerus. It can also depress the shoulder, preventing its upward movement. So that's the type of movement, and the shape we've said it's flat, triangular, and it tapers as it ascends to a narrow tendon that inserts to the anterior superior surface of the humerus. Now, where is the position? It's positioned in the lower portion of the back. Now the origin and insertion. The origin of latissimus dorsi is on ribs 10, 11, and 12. Spinous process of thoracic 7 to lumbar 5. The sacrum, iliac, and iliac crest. So ribs 10, 11, 12. Spinous process of T7 to lumbar 5. The sacrum and iliac crest. The insertion. It's inserted on the floor of the intertubercular sulcus of the humerus. Here is another picture that shows its insertion on the floor of intertubercular sulcus at the anterior superior surface of the humerus. in the intertubercular sulcus. Intertubercular sulcus. What about the innervation and blood supply? The innervation, it's innervated by the thoracodorsal nerve from the cervical plexus. That's the primary innervation of latissimus dorsi, thoracodorsal nerve of cervical plexus. So innervation, thoracodorsal nerve of cervical plexus. Associated with this nerve is the thoracodorsal artery, which is the primary blood supply to the latissimus dorsi. That's for the lateral big part of the muscle. We also have dorsal branches coming from posterior intercostal arteries, and lumbar arteries, supplying the medial part of the muscle, medial parts. But the big, huge chunk of the muscle is supplied by the thoracodorsal artery. The medial part is supplied by dorsal branches of posterior intercostal arteries and lumbar arteries. Here's another picture that shows its insertion anterior superior surface of the humerus on the intertubercular sulcus. Here's a picture showing the blood supply. Here is the axillary artery, subscapular artery, giving circumflex arteries, and the thoracodorsal artery, supplying the big chunk of the muscle. It has descending branch and horizontal branch, while the medial part of the muscle is supplied by dorsal branches of posterior intercostal arteries and lumbar arteries. Now, levator scapulae, shape, position, type of movement, origin, insertion, blood supply, nerve supply. Shape, position, type of movement, origin, insertion, blood supply, and nerve supply. It is slender in shape. The position, it descends from the transverse processes of the upper cervical vertebrae to the upper portion of the medial aspect of the scapula. That's for position. So, slender muscle that descends from transverse processes of upper cervical vertebrae to the superior portion of the medial border of the scapula. What is the type of movement? It elevates the medial border of the scapula upwards, and when it elevates the scapula upwards, it assists other muscles in rotating the lateral aspect of the scapula inferiorly. When it elevates the medial aspect of the scapula upwards, it assists other muscles in rotating the lateral aspect of the scapula downwards. So, the origin and insertion. The origin is transverse processes of cervical 1 to cervical 4, cervical 1 to cervical 4, cervical 1, 2, 3, 4, and the insertion on the upper portion of the medial border of the scapula. Now, let's talk about the blood supply and the innervation of levator scapulae. We have the inferior part and the superior part. The inferior part is supplied by the transverse cervical artery, and the ascending cervical artery supplies the upper part. So we have transverse cervical and the ascending cervical. In the innervation, it's innervated inferiorly by the dorsal scapular nerve, and the upper part by the anterior rami of spinal C3 and C4. And the dorsal scapular nerve. Now the rhomboids, rhomboid major and rhomboid minor. Their position, shape, origin, insertion, blood supply and nerve supply, and type of movement. Their position, they lie inferior to the levator scapulae. This is the levator scapulae. They lie inferior to the levator scapulae. The rhomboid minor is superior to the rhomboid major. It is small, cylindrical in shape. It attaches to the nuchal ligament and the spinous processes of 7th cervical vertebrae and thoracic 1, and attaches to the medial scapular border, just opposite the root of the spine of scapula, Now, the larger rhomboid major originates from the spinous processes of the upper thoracic vertebrae. It attaches to the medial scapular border, just inferior to the rhomboid minor. That's their position. Now, what type of movement do you think they do? These rhomboid muscles work together to retract or adduct the scapula toward the vertebral column. They adduct the scapula towards the vertebral column, and they work with other muscles to rotate the lateral aspect of the scapula inferiorly. Now, when the medial border of the scapula is lifted upward and medially, the lateral border of the scapula can be rotated inferiorly. So they are located inferior to the Levator Scapulae. We have small minor and large major. The major lies below the minor. They attach to the medial border of the scapulae, rhomboid minor just opposite the spine, and rhomboid major below the spine and between the spine and the inferior angle. Now, the origin and insertion. The rhomboid minor is originated from the nuchal ligament and the spinous process of 7th cervical and 1st thoracic, 7th cervical, 1st thoracic, and nuchal ligament. The rhomboid major originates from the spinous processes of cervical 2, 3, and 4. 2, 3, and 4. Now the insertion. The rhomboid minor is inserted at the medial border of the scapula opposite the spine, and the rhomboid major is inserted in the medial border of the scapula between the spine and the inferior angle. Between the spine and the inferior angle. Now let's see the blood supply and innervation. Blood supply and innervation. Both muscles are innervated and supplied by the same nerves and arteries. They are innervated by the dorsal scapular nerve. There is the dorsal scapular nerve from C4 to C5. C4 and 5 dorsal scapular nerve runs like this and supplied by deep branch of transverse cervical arteries. This table represents a summary of the origins and insertion of superficial muscle. Let's see the trapezius. It's inserted in superior nuchal line, external occipital protuberance, nuchal ligament, spinous processes of 7th cervical to thoracic 12. Inserted into lateral 1/3 of clavicle, acromion process, and spine of scapula. Latissimus dorsi. It's originated from spinous processes of thoracic 7 to lumbar 5, sacrum, iliac crest, and ribs 10, 11, and 12. Inserted into the floor of the intertubercular sulcus of the humerus. Levator Scapulae is originated from the transverse processes of cervical 1 to cervical 4 and inserted into the upper portion medial border of scapula. The rhomboid major is originated from spinous processes of thoracic 2 to thoracic 4. The rhomboid minor is originated from the lower portion of nuchal ligament, spinous processes of cervical 7 and thoracic 1. The rhomboids are supplied by the dorsal scapular nerve, the Levator Scapulae, anterior of C3 and C4, and dorsal scapular nerve, Latissimus dorsi by thoracodorsal nerve C6 to C8, the trapezius, the motor by spinal accessory nerve, and proprioception fibers passes through the cervical plexus at the level of C3 and C4. And now the functions. Rhomboids adducts and elevates the scapula. Levator Scapulae elevates the scapula. Latissimus dorsi extend adducts and medially rotate the humerus, and trapezius assists in rotating the scapula when you raise your arm above your head. Last thing we want to discuss in this video lesson is the intermediate group of back muscles, which are also called the respiratory group. We should discuss shape, position, origin, insertion, blood supply, nerve supply, and type of movement. These muscles include serratus posterior superior and serratus posterior inferior, serratus posterior superior and serratus posterior inferior. So let's describe them. These are two thin muscular sheets in the superior and inferior regions of the back. Why they are called intermediate? Because they lie immediately deep to muscles of the superficial group. The fibers of serratus posterior superior passes outward from the vertebral column and obliquely downwards and attach to the ribs. However, fibers of serratus posterior inferior passes obliquely and upward from the vertebral column to attach to the ribs. This orientation makes them considered as a respiratory group, as they increase the diameters of the chest and assist in respiration. Now, the serratus posterior superior is located deep to the rhomboids, and the serratus posterior inferior lies deep to the latissimus dorsi. Serratus posterior superior deep to the rhomboids, serratus posterior inferior deep to the latissimus dorsi. Let's see the origin of the serratus posterior superior. The lower portion of nuchal ligament, the spinous processes of cervical 7 to thoracic 3, first thoracic, second thoracic, and third thoracic. It's also attached to the supraspinous ligaments. So, lower portion of nuchal ligament, the supraspinous ligament, the spinous processes of cervical 7 and the first 3 thoracic vertebrae. The insertion. They are inserted into the upper border of ribs 2 to 3 and 4. Ribs 2, 3 and 4. 2, 3 and 4. Just lateral to the angles. Just lateral to the angles. So origin, lower portion of nuchal ligament, supraspinous ligaments, and spinous processes of cervical 7, thoracic 1, 2, and 3. Insertion, upper border of ribs 2, 3, and 4, just lateral to their angles. What is the function of this muscle? It elevates ribs 2, 3, and 4. It elevates ribs 2, 3, and 4. Now let's see the origin of the serratus posterior inferior. It's originated from the spinous process of thoracic 11, 12, lumbar 1, 2, and 3. So spinous processes of the thoracic 11 to lumbar 3. And the supraspinous ligaments, which is on the tips of spinous processes. It's inserted into the lower border of ribs, not like the serratus posterior superior where it's attached into the upper border. The serratus posterior inferior attaches or inserted into the lower border of ribs. Lower border of ribs. Which ribs? 9, 10, 11, and 12. 9, 10, 11, and 12. Just lateral to their angles. Just lateral to their angles. Here's the angle, just lateral to it. What is the function? It depresses ribs 9 to 12. Depresses ribs 9 to 12, and also may prevent the lower ribs from being elevated when the diaphragm contracts. Now, blood supply and innervation. These muscles are innervated by segmental branches of anterior rami of intercostal nerves. Anterior rami of intercostal nerves. Segmental branches. Now, the serratus posterior superior is innervated by anterior rami of upper thoracic nerves. Thoracic 2, 3, 4, and 5. 2, 3, 4, and 5. However, the serratus posterior inferior is innervated by anterior rami of lower thoracic nerves. Thoracic 9, 10, 11, and 12. 9, 9, 10, 11, and 12. So anterior rami of spinal nerves. The superior by thoracic 2, 3, 4, and 5. 2, 3, 4, and 5. The inferior by 9, 10, 11, and 12. 9, 10, 11, and 12. And their blood supply from similar pattern of posterior intercostal arteries. Posterior intercostal arteries. This table represents a summary of the intermediate muscles. We have the serratus posterior superior, serratus posterior inferior. Innervation anterior rami of spinal nerves. Anterior rami for the superior from thoracic 2 to thoracic 5. The inferior from thoracic 9 to thoracic 12. They either elevates in the case of superior or depress in the case of the inferior. The origins, lower portion of nuchal ligaments, spinous process of cervical 7 to thoracic 3, and supraspinous ligaments. The serratus posterior, the spinous processes of thoracic 11 to lumbar 3, and supraspinous ligaments. The insertion, the superior upper border of ribs. The inferior lower borders of ribs. The serratus posterior superior from ribs 2 to 4. From ribs 2 to 4. The inferior from ribs 9 to 12. 9 to 12. Now it's time to test your knowledge. Please participate in the comment section down below. Muscles of the back are organized into superficial, intermediate, and deep based on they are organized into intrinsic and extrinsic based on one of the following muscle groups is also called the Appendicular Group. Insertion of rhomboid minor, insertion of Trapezius, insertion of Levator Scapulae, insertion of rhomboid major, insertion of Latissimus dorsi, insertion of serratus posterior superior, insertion of serratus posterior inferior. One of the following does not form a part in the origin of trapezius muscle. Levator Scapulae is innervated by the motor innervation of trapezius muscle is by the rhomboids are innervated by Latissimus dorsi is innervated by serratus posterior superior is innervated by serratus posterior inferior is innervated by the origin of Latissimus dorsi, the origin of Levator Scapulae. Where is the origin of rhomboid minor? origin of rhomboid major, origin of serratus posterior inferior, and origin of serratus posterior superior. Which artery or arteries provides blood supply to the trapezius muscle? Which artery or arteries provide blood supply to latissimus dorsi muscle? Which arteries provide blood supply to levator scapulae? Which arteries provide blood supply to serratus muscles? What is the function of rhomboid minor? What is the function of rhomboid major? The function of serratus posterior inferior is the function of trapezius. The function of levator scapulae is the function of latissimus dorsi. The function of serratus posterior superior. One or more of the following muscles is flat and triangular. To see more quality content, please don't forget to subscribe, give thumbs up, and share with your friends. Thanks for watching. See you in the next video.